In the tumultuous era of the 1960s, America was a nation on the brink of radical change. Amidst the fever of the civil rights movement, the fight for women's liberation, and the early stirrings of the push for LGBTQ equality, a visionary named Dr. Mary Calderon rose to prominence.
What children need from us is information to answer all of their questions. This is a must, just to protect them against the misinformation and wrong attitudes that are all around us.
Born into a world where discussing sex was taboo, Calderon's early experiences in the public health system of Great Neck, New York, and her groundbreaking tenure as medical director at Planned Parenthood shaped her resolve to challenge deeply ingrained sexual health misconceptions. And with the founding of the Sexuality, Information, and Education Council of the United States, SIECUS, in 1964, Calderon set out to revolutionize sex education. Her mission was to establish sexual health as a fundamental human right, deserving of candid and compassionate dialogue. This mission was emboldened by significant medical and social milestones. The approval of the first birth control pill in 1960 heralded a new era of reproductive autonomy, and the Civil Rights Act of 1964 paved the way for greater social justice, setting the stage for Calderon's advocacy. She leveraged her status to challenge the medical establishment's resistance towards birth control, leading to the American Medical Association's historic endorsement of contraception in 1964. The debate reached fever pitches, with Calderon often at the center of public and political controversy. Yet, it was this very opposition that underscored the critical need for informed sex education.
There is only one sure way to avoid undesired pregnancy. Avoid sexual intercourse.
In response, Calderon championed the first ever SIECUS report in 1972, a bold publication that drew from contemporary research like the Kinsey Institute's findings to challenge and expand the national conversation on sexuality. This report and others boldly addressed topics ranging from childhood sexuality to contraceptive care for minors, pushing the boundaries of traditional discourse. Dr. Mary Calderon's early efforts and the foundation of SIECUS were not merely about providing information. They were about transforming how society approached and understood human sexuality. Through her unwavering commitment and strategic insight, Calderon navigated a complex array of social, political, and cultural challenges to lay a lasting groundwork for sex education. Her legacy endures in the principles and practices of SIECUS, which continue to influence and inform debates on sexual health and education, advocating for a world where these discussions are embraced as essential to human dignity and right.
Most of all, children need parents who can show love for each other and for their children. For in such a home, sharing knowledge of this great and universal human experience can only serve to strengthen family ties.
I have worked very hard for 4 years. That's the question.
Under the leadership that followed Dr. Calderon, SIECUS took a proactive role in advocating for comprehensive sex education.
Mary Calderon brought the words sexuality education to American attention in the early 60s and 70s when she was doing her initial work. And through the decades, SIECUS has taken a leadership stand in defining what sexuality education is, helping people understand why people need sexuality education at all levels, not just in schools, and working in the social justice area to make sure that all people have sexual rights.
I think, starting with Mary Calderon, who really began having a national conversation about sexuality education and sexuality and sexual health. Mary wrote lots of articles and did a lot of speaking, publishing the SIECUS report and other publications.
SIECUS has been a consistent voice over more than 50 years about the importance of sex education for young people, for all of us in the United States, and also to some extent globally.
But the landscape was changing. The federal government poured funds into abstinence-only education, directly challenging SIECUS's evidence-based approach. While internationally, SIECUS expanded its reach, adapting its strategies to align with the local cultural sensitivities and needs, which was crucial in fostering global partnerships and tailoring programs that resonated with international audiences.
AIDS epidemic actually was part of how we were able to reposition SIECUS post Mary Calderon as a major force in America.
HIV and AIDS was all anything could talk about, particularly when I first got there in 1994. And in fact, the funding that we had from CDC was actually HIV prevention money. It wasn't, I brought the sexuality education perspective, sometimes much to their horror, but it was actually HIV prevention.
I think truly the AIDS epidemic changed the entire landscape of sex education. So we went from maybe teen pregnancy prevention to prevention of a deadly disease, and no one wanted to get there.
I would say the biggest misstep was underestimating the power of the abstinence-only movement.
We also really ramped up our policy work in Washington, D.C., because we were starting to see the right gain some traction in changing policy and even getting funding for abstinence only.
Young people deserve the straight information, the straight talk from adults, and AB only gives them a very warped message that's not going to be useful for very long.
Like, there was one curriculum that suggested or recommended spraying your genitals with Lysol to disinfect them. We actually wrote a cease and desist. We actually informed Lysol, and they wrote a cease and desist letter.
It took us a while, I think, to really understand what a threat this was going to be. And the fact that we are continuing to fight the abstinence-only, purity culture is remarkable, that they became such a major force.
Abstinence only is not complete education. It misinforms young people about condoms and contraception. It forbids, oftentimes, discussion of sexual minority issues, sexual diversity. So it's very much focused on a single behavior.
Therefore, through strategic advocacy and persistent outreach, SIECUS not only countered misinformation at home, but also significantly influenced sexual health policies in developing nations. Their efforts during this era were marked by a steadfast commitment to science and inclusivity, shaping public health initiatives that recognize the diverse needs of communities worldwide.
So Mary had been at Planned Parenthood. She felt like they didn't have enough of an emphasis on doing kind of that fundamental basic sex education, and she started that. And we continued it, but in a different time, right?
Martin Luther King suggested the arc of history is long, but it bends towards the righteous. So let's leave it at that. I think we'll get there, but it's not going to be without struggle, and it's not going to be immediate, but it's coming.
Needs to continue to be a leading voice for sexual rights, a leading voice for social change, a leading voice for affirming sexuality as a wonderful part of life that needs to be exercised responsibly.
In the last decade, SIECUS has not only continued but intensified its advocacy, navigating a landscape marked by both progress and setback in America's personal freedoms and reproductive rights. And as new challenges emerged, SIECUS's strategies evolved, focusing on leveraging their coalition bodies to influence governmental entities such as the CDC, and helping to work with members of Congress to develop the Real Education and Access Healthy Youth Act, a policy that supports quality sex education across all government levels. But the journey is far from over. Today's social and political climate presents fresh challenges, requiring SIECUS to be more dynamic and innovative than ever before. As a critical voice in the ongoing debates surrounding reproductive freedoms and sex education, SIECUS is emphasizing the need for educational frameworks that embrace all aspects of human sexuality. And as we look ahead, SIECUS calls upon a new generation to join in its mission, energizing supporters to rally for the cause of comprehensive and quality sex education. By continuing to advocate, educate, and legislate, SIECUS aims to ensure that future policies reflect a commitment to the health, autonomy, and rights of individuals across the globe. The legacy of Mary Calderone lives on, inspiring ongoing efforts to achieve a world where sex education empowers and liberates.